Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about asthma and the unknown triggers. What are the mechanisms that may influence asthma or breathing difficulties or wheezing, right? When we first look at asthma, we think about the IgE Mediated Response. What is that? That's an acute response to an allergen, whether it be mold, a food. If you remember the movie Hitched, Will Smith played a character in there, and he actually had shellfish or shrimp, and his face blew up like a balloon. That is a IgE response to a food, right? So shellfish is a known trigger for a IgE response or allergic response, right? So that's one response. There's also a delayed food reaction, right? A delayed food reaction is more of not immediate, but maybe the day after. You feel a little bit of brain fog, you don't feel as well, feel a little bit sleepy, you have some GI distress, right? So it's not immediate, but it follows maybe the day or 2 or 3 days later. Now, what are some of the common foods for that? One is dairy, your milk and cheese and yogurts, etc. Grains, particularly gluten-containing grains, but all grains can be a problem in terms of causing a delayed response. Eggs, soy, legumes, some nightshades, MSG, monosodium glutamate. MSG is a trigger for asthma, but a lot of people don't realize it. And it's hidden in a lot of different processed foods and in restaurant foods, right? Because it gives it a lot of flavor in the food when they cook. So MSG is a problematic thing. And the reason is in the lungs, right, in the bronchioles, there are receptors for MSG, or monosodium glutamate. And when you eat MSG, what happens is you get bronchial spasms, right? Your lungs can't contract as well or expand as well, and therefore it creates a spasm, causes difficulty breathing. So any of you who had that type of reaction, please make a note down below and let me know if you had a problem with MSG. The other ones are obviously shellfish, clams, it could be lobster, it could be shrimp, etc., right? Another one is exercise-induced asthma. Now, exercise-induced asthma, why would that occur, right? Exercise in itself is breaking down tissue and causing oxidative stress. So we're talking about like a vigorous exercise, you're running, right? Sprinting, you're doing some sort of weight training. What do you feel the next day? You feel sore, achy, stiff, right? That is actually low-grade inflammation. So when you have exercise, you're actually creating some oxidative stress, very low-grade inflammation when your tissue starts to break down a little bit. And that in itself is enough to trigger an exercise-induced event with asthma. Now, when we look at food reactions or delayed food reactions, that can compound exercise-induced asthma. What does that mean? So let's say you eat a lot of different foods that are not really that good for you, and you have very low-grade inflammation. And then you go out and you exercise really hard, and then all of a sudden you have breathing difficulties. What you've done is you've had a cup that was partially filled with inflammation because of unknown delayed food reactions, and then you went and you exercised, and that in itself created filling of the cup. So half was full, and then you exercise and it overflows, and then you develop an episode of asthma. Another one is environmental triggers. Things like mold, animal dander, smoke, dust mites, even cockroaches, right, can be triggers for asthma. So environmental things, even certain foods with sulfides in them. So you have to be very careful with what you're eating. So what does all of this have in common, right? They all have in common that it creates oxidative stress and inflammation. Oxidative stress is basically oxygen reacting to tissue due to, let's say, exercise, breathing, etc. So oxidative stress will occur, and then there's a low-grade inflammatory process. When you have this going on, then your asthma can be triggered. So the unknown trigger that we're talking about here is oxidative stress and inflammation, right? If we have oxidation and inflammation because of these types of things, then what is our job? How do we take care of this, right? So let's go ahead and flip this over. In our traditional model, or medical model, we actually have things like inhalers, right? Inhalers or oral steroids to knock down the inflammation in your lungs, right? And then they have something called Leukotriene Modifiers. Now that's usually used for COPD or chronic obstructive pulmonary disease, like smokers, etc. But they've been using that for asthma patients as well. So when we look at it, it's medication, right? You have an event, you take your steroid or your medication, it reduces the effect and you can breathe a little bit better or easier, right? So this is the answer. But long-term use of steroids is really not good for our body, right? It weakens our tissue, it weakens our immune system. So what is our functional approach or functional medicine approach? Well, what do we do in our office? When we have a patient who comes in, we look for triggers. First thing is diet. What dietary triggers are there for that patient? One of the best ways actually to do this is a elimination diet. You eliminate the food categories that create problems for patients. Things like grains, nuts, seeds, lectins, right? Nightshades, soy, dairy. You eliminate foods that are common triggers for asthma, and you do it for 30 days at least, right? To see if you have an impact. Then you got to reduce environmental triggers, right? If you're allergic to cats and you have cats in the house, you're creating inflammation. Mold. A lot of homes have mold in them, right? Or work environments have mold in them. I've had a lot of teachers actually tell me their school is full of mold. So when they go to school, they feel like they have asthma type reactions or breathing difficulties. So environmental mold becomes a problem because it creates oxidative stress and inflammation. So we have to figure out what the environmental triggers are for patients. Then we have to reduce inflammation. Reducing inflammation is getting rid of those triggers first. And then we can use supplementation to help a patient recover, right? So what kind of supplements will we use, right? Things like coenzyme Q10, CoQ10, or methylated B vitamins, or methyl Bs, right? That's very important. Vitamin A, magnesium, okay? And anti-inflammatories like curcumin, boswellia, resveratrol, right? If you can use certain nutrients and knock down inflammation naturally rather than using steroids, you're going to be better off in the long run, right? So our job is to maintain health as you recover, but you have to be able to reduce the environmental triggers before you take these supplements. So it starts with the diet, an elimination diet, or a very clean diet with getting rid of all the environmental triggers known for asthma, things that I've mentioned, or you can look up more on the internet, obviously. Getting rid of the environmental triggers, right? And then reducing the inflammation by using supplementation, okay? So it's very important to understand why asthma might occur, and there are strategies, natural strategies, to get you better and recover. And instead of using an inhaler every day, you might use it once a week or once a month when your body's really stressed. So that in itself is a huge bonus to it, because if you reduce your medication over time, the impact of the steroids, which is negative, can be minimized, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.